Glucometers are used to measure a patient's blood glucose level. Not all states allow EMTs to utilize glucometers, so be sure to familiarize yourself with your local protocols. Even if you are not authorized to use a glucometer independently in the field, you may need to assist a patient or family member with using a personal glucometer, so it is important for you to have a basic understanding of the process. The first step is to don the appropriate PPE, which includes gloves and eye protection at a minimum. I will be demonstrating this skill on myself, which is why only one of my hands is gloved. Cleanse the testing site, which is typically on a finger, with antiseptic. Then, prepare the lancet device by inserting a sterile, single-use lancet needle. Use the lancet device to puncture the recently sterilized testing site on the patient's finger. Be sure to properly dispose of the lancet needle in a sharps container. Collect a drop of blood on the test strip. Insert the test strip into the glucometer and activate the device per the manufacturer's instructions. The glucometer should now display the patient's blood glucose level. A normal blood glucose level should fall between 60 milligrams per deciliter and 120 milligrams per deciliter, depending upon when the patient last ate. For patients with extremely high or extremely low blood glucose levels, the glucometer may not give you a numerical reading. Instead, it may just say high or low. The blood glucose levels that trigger a high or low result vary amongst manufacturers. On average, if the glucometer gives you a low result, the patient's blood glucose level is less than 30 milligrams per deciliter. When a glucometer displays a high result, it typically means that the patient's blood glucose level is greater than 300 milligrams per deciliter. Finish the process by placing a bandage over the puncture site on the patient's finger. Currently, the use of glucometers is not included in the New Jersey EMT scope of practice.